It is time to have hip replacement when you have severe hip arthritis which has failed conservative management. Hip replacement surgery involves making an incision around the hip, accessing the hip joint, removing the arthritic parts of the bone on each side of the joint, and replacing it with metal and plastic. Hip replacement surgery involves removing the arthritic parts of the bone and replacing it with metal and plastic. So this is a model of a hip replacement, and the top part of the joint, which is the pelvis, a metal shell is put into the socket of the joint, and then on the other side of the joint, a metal stem is put into the femur, which is hollow. Your bone will grow into that metal on both sides, and then there's a ceramic ball that fits in the plastic liner of the metal shell. The main approaches to a hip replacement are the anterior and the posterior approach, which means from the front of the hip versus from the back of the hip. Those are two very good approaches that allow you to do the surgery safely, and I do both of them. I prefer the anterior approach because it tends to be a more stable hip replacement and tends to give an earlier, easier recovery, but for different reasons, one may be indicated over the other for certain patients. The benefits of the anterior approach to hip replacement are that it tends to make an early recovery for the patients because we don't have to cut any muscle. And long term, it tends to be a more stable hip replacement, meaning the risk of dislocation is lower. Hip replacement surgery takes approximately 45 minutes to complete. Patients are then monitored for anesthesia after the surgery for several hours, waiting for anesthesia to wear off. Once that process happens, we get them up and walking, have them go to the bathroom, and then get them home. The vast majority of our hip replacement patients go home the same day of surgery. For a variety of reasons, some patients may need to spend a night or two in the hospital, whether that's for medical problems that they have or they don't have help at home. But we have a great perioperative program at St. Joe's where we're able to get 90% or more of our hip replacement patients home the same day, and our patients have been very happy with that. The improvements in our surgical technique and the implants that we have at our disposal today, a typical hip replacement can last many decades. Expectations for hip function after hip replacement are that it dramatically improves the function and range of motion of the hip. Range of motion after hip replacement improves immediately in patients with severe arthritis. And long term, since we don't cut any muscle, they regain a lot more power and function of the hip than they did before surgery.